everybody. Today I'm here to talk about the flu. It may seem like this is a really strange time of year to discuss this, and it may seem like, what made me think about this. So I'm going to give you a little backstory so that you'll understand what made me start doing some research and what prompted this video. My husband works in the healthcare industry, and this last year, they made it mandatory to receive the flu vaccine. And if you did not receive the flu vaccine, then they would say that was your resignation. That if you didn't get the flu vaccine, then they accepted your resignation and you were fired. Or you were quitting, basically. So my husband, I told him at that time, they did say there was a possibility of a religious exemption. And we got the paperwork and we looked at it, and I filled it out because I personally thought that he should be able to do that. But at that time, my husband really didn't feel like he had the beliefs that he could have a religious exemption from getting the flu vaccine. So he went ahead and he got the flu vaccine like his job required, and he didn't immediately get sick. We did all have the flu. This is the first time we've ever had the flu, our children included. My husband did bring it to us, but it was about a month or two later after he got the flu shot. So we didn't really consider it like, sometimes they say you get the flu shot and you get the flu. He did get the flu, so the flu shot did not keep him from getting the flu. It did not give him any immunity to that, or at least he got a strand of the flu, or a strain of the flu. So we didn't really see the protection from that. Because he got the flu shot, we didn't put two and two together until I started doing some research the last couple of weeks and realized that my husband has been sick since November when he got the flu shot. He has been sick off and on, and his asthma has come back with a vengeance. He has not had asthma in a very long time. He had asthma when I first met him, and his asthma was really bad, and he had a nebulizer. I don't know if you know somebody with asthma, you know all of this information. If you don't know anybody with asthma, then this is all very foreign to you. Because whenever I met him, I had never really been around anybody with asthma. But he had a nebulizer. He had to do nebulizer treatments all the time. And he had a rescue breather inhaler with him all the time, an albuterol breather with him all the time whenever I met him. And he was a very sick person. He had nasal polyps, had all kinds of surgeries, had steroid packs. He was just a very sick person. It took me several years of working on him to get him well and healthy and away from the loop that he was in with his vicious cycle of his asthma and the steroids and everything that he was on. So I finally got him out of that vicious loop, and he has been very healthy for the last 10, 15 years. And then we were just really trying to figure out what has caused this resurgence of asthma. Why is he so sick? He can't even speak. It has been 2 months since he could speak properly. His vocal cords, he sounds really hoarse, like he has laryngitis. He's been like that for 2 months. And we have been really just trying to figure out what is wrong, why is this happening, what is causing these issues. And I started doing some research and finally figured out what we think might be a link. And this is one reason why you're only going to find 1% of vaccine injuries on the vaccine injury website, because most people are like me and my husband, who put two and two together at a way later date, and it's probably not something that you're going to be able to say specifically, yes, this caused this problem, but the signs point to what else could it have been. This has to be it. So I want to go over with you today what is in the flu vaccine and the ingredients in it, and just so you can make an informed choice yourself, because my husband was not aware of the things in the flu vaccine that were going to cause him to have asthma, and he did not realize that he would end up sick for over 6 months now because of the flu vaccine that was supposed to protect him from the flu, which it did not protect him from the flu. He did get it. So I'm going to just go through this with you, and I am not doing anything. This is not an emotional video. This is not a debate video. This is a factual. I am putting the information out here for you. You can take this information, do with it what you will. You can turn me off. I don't really care if you don't want to hear the information. What I'm doing is giving you the ability to look into this information for yourself and make an informed decision, because a lot of people do not know the facts. And I don't want any hate language. I do not want any negative, mean comments You are welcome to disagree with me, and you are welcome to put out any facts that you have. I will be putting all of my sources down in my comments. I will be making sure to give you the information. You can go look it up yourself. I've taken all of these from reputable sources. These are places that a lot of them are from the CDC, vaccine.gov, all of these places that are legitimate sources. So I'm not going on to some kind of woo page and getting information. I make sure that my sources are good sources. And if you do not agree with me, that is fine. But you also need to look at the sources yourself. If you don't agree with the words coming out of my mouth, I'm going to be doing a lot of reading. So I'm going to be taking this information from the sources that I will be citing later on. So if you don't agree with me, that's fine. But please don't call me names and be ugly to me. I've had people really be ugly to me, and it's just not necessary. So let's be nice. Let's keep this beautiful, and let's inform each other. And if you have information that I don't know, absolutely share that with me, but do it on a nice level. So I'm going to go on ahead with this information, and this gives a really awful glare on my face, so sorry for y'all on that. All right, there are a lot of different flu vaccines. Just to tell you the truth, there are about 12 out there right now, and they have different ingredients. There are some with more, some with less. My husband actually tried to find a vaccine that didn't have as many ingredients in it, and the one that he chose did not have formaldehyde in it. So he thought he was doing great because he thought, yay, I got one without formaldehyde in it. And for those of you that do not know any vaccine ingredients, your mouth might be hanging open right now, knowing that some vaccines do have formaldehyde in them. But yes, they do. So there are about 12 of them. We found the one on here that we think is his. I'm going to just be discussing that vaccine today. However, I will also discuss formaldehyde at the very end so that you know if you got a vaccine that had formaldehyde in it, what that causes as well. So I'm going to basically just go over the ingredients, and then after I tell you the ingredients, I'm going to go over each ingredient individually and tell you about that ingredient and what that ingredient side effects are, what the reasoning for that ingredient is, etc. So I'm going to be mispronouncing words. I actually went on Google and tried to find the different words that are very hard for me to say, and I tried to learn how to pronounce these words, but there were several of them, so I may mispronounce this. If I do, forgive me, and just know that I'm trying my best, and there's some big words out there in this world. So, the one that we're doing is the influenza effluria trivalent quadrivalent. That's the one that my husband thinks he took. So, it has sodium chloride in it, monobasic sodium phosphate, dibasic sodium phosphate, monobasic potassium phosphate, potassium chloride, calcium chloride, sodium tarodexacolate, ovalbumin, I always say it wrong, ovalbumin, sucrose, niacin, sulfate, polymyxin B, beta-propiolactone, thimerosal, which that's mercury, and that's in the multi-dose vials, which you can get a vaccine that's not a multi-dose, but it is very uncommon. Most vaccines are going to be multi-dose if they can come in the multi-dose because it's less shelf space and it lasts longer and it's cheaper. So most doctors are going to go for the multi-dose vials, and you're going to be getting thimerosal. So they do not have to put the thimerosal in there. It's in there as a preservative, but the mercury is usually added for the benefit of the shelf life and the doctors having the lower costs. So, all right, we're going to start out. I'm going to read to you what you should be getting when you get your flu vaccine, which I don't know. Most people don't read their packets if they get a packet. I don't think my husband received a packet or an insert of information from when he got his flu vaccine. But this is on the insert. I took this straight from the insert off of the CDC vaccine website. I've got the source for this later on. But here are your reported side effects for your flu vaccine. Okay, report side effects include flu-like symptoms, pain, redness and swelling at the injection site, irritability, fever, febrile seizures, Guillain-Barré syndrome, drowsiness, loss of appetite, vomiting, diarrhea, allergic reactions, anaphylactic shock, bleeding from low platelet counts, swollen lymph nodes, inflammation of the brain and spinal cord, encephalopathy, encephalopathy, nerve dysfunction in the eyes, face or arm fainting, nerve dysfunction in the eyes, face, or arm, fainting, dizziness, inflammation of the blood vessels, shortness of breath, Stevens-Johnson syndrome. I had to look up Stevens-Johnson syndrome because I'd never seen it before. It is an awful, painful rash that attacks your mucous membranes all over your body and takes several months to get better. It's very painful and it looks really awful. So that's what Stevens-Johnson syndrome is if you've never heard of that. Chest pain, body aches, fatigue, rapid heart rate, high eye infection, eye redness, swelling, tonsillitis, asthma flare-up. There's that one. Hinochskeleon purpura. I didn't look that one up. Wow, I don't know what that is either. Difficulty swallowing, muscle tightness, abnormal gait, arthritis, tremors, and limb paralysis. So those are your side effects. And I know a lot of you may not know what encephalopathy is. That's actually attacking your brain. That's a long list. That's a very scary list to me. And you don't know if this will affect you like this. And one flu shot may not necessarily do it, but another flu shot may do this. That's a lot of side effects to not have a 2-week flu. Just putting that out there. That's scary. That's a very scary. And if you don't know what, and I never say this correctly either, I've listened to the pronunciation over and over and over again. Guillain-Barré syndrome it's paralysis. It's paralysis. And I actually know someone that has gotten that from the flu shot. And that's just scary. Okay. So moving on. We're going to go on to each individual ingredient, and we're going to discuss each one. Sodium chloride. Sodium chloride is known to raise blood pressure and inhibit muscle contraction and growth. And that's all I have on that one. Sodium phosphate. Sodium phosphate I could not find in the injection. I could only find it in the oral solution or the oral tablet. I could not find it for the injection. So some of these I couldn't find the exact same thing that you would be getting if you got the vaccine, but it's still kind of, if you were taking this orally, this would do this to you, so it would probably be worse if you were having it injected. So just put that out there. So it causes, the common side effects for sodium phosphate are abdominal or stomach pain, bloating, nausea, and vomiting. Alright, and here is the nice long list of things. They're not really sure how many people get this, but that there are a lot of people that get this. They don't really know the incidence rating on it. Agitation, bloody or cloudy urine, burning, crawling, itching, numbness, prickling, pins and needles, or tingling feelings, coma, confusion, cough, decreased urine output, depression, which my husband has also been extremely depressed and he can't figure out why. But just to put that in perspective, his father did die last year, so that comes with some depression. Difficult or labored breathing, difficult or painful urination, difficulty with swallowing, dizziness, fainting, fast, slow, irregular heartbeat, headache, hostility, irritability, lethargy, muscle twitching, noisy breathing, puffiness or swelling of eyelids or around eyes, face, lips, or tongue, rapid weight gain, redness of skin, seizures, skin rash, hives or welts or itching, stupor, swelling of the face, ankles, or hands, tightness of the chest, unusual tiredness or weakness. Ooh, okay, so there's also symptoms of overdose. I'm not going to bother to go into the symptoms of overdose because that's just like, this list, it could go on a really long time. I did an MMR vaccine ingredient list a couple months back, or a few weeks back, and I thought that was a long video, and I thought those were a lot of ingredients, but I mean, this is just long, and I am sorry, but if you get tired of listening to all the flu vaccine ingredients, just know that I can't find one in here that's actually sounds safe. They're all really scary, and the only one I couldn't really find anything on is sucrose, but everything else in here, I'm like, oh. The last ingredient, my mouth dropped open, y'all. It was a long time before my mouth went back. I had to like lift my mouth back up. Everybody in the room, I was like gasping for breath. I was in shock that this was in a vaccine. I just, wow. Okay, so I'm going to skip through the rest of that stuff, but yes, there's a whole lot more, and I'll put the site on there, and you're welcome to go and look for that if you would like to later on. Okay, the next one is potassium phosphate. Potassium phosphate in the intravenous solution. It may cause some unwanted effects, although not all the side effects may occur. They do occur, and they may need medical attention. So here are the things for that. Burning, crawling, itching, numbness, prickling, pins and needles or tingling feelings, chest pain or discomfort, confusion, dizziness, faintness, and lightheadedness when getting up suddenly or lying down in a sitting position, fast, slow, irregular heartbeat, muscle cramps in hands, feet, arms, legs, or face, no muscle tone or movement, numbness and tingling around the mouth, fingertips, or feet, pounding or rapid pulse, shortness of breath, unusual tiredness or weakness, weakness and heaviness of legs. And are you seeing a trend here? So far, all of the ingredients that I've listed off cause some kind of lung, asthma, breathing issues. No wonder my poor husband is dying now. I mean, this is just unreal. Every single thing that I look up just causes these issues. I could go on. I'm not going to go on any further with that because it goes on so long, y'all, the stuff that this does. It does say here, potassium chloride is generally considered a safe ingredient. The side effects may be severe allergic reactions, rash, hives, itching, difficulty breathing, tightness in the chest, swelling of the mouth, face, lips, or tongue, black, tarry stools, chest pain, irregular heartbeat, listlessness, numbness or tingling in your skin, lips, hands, or feet, severe nausea or vomiting, stomach pain or swelling, unusual confusion or anxiety, unusual muscle weakness or paralysis, vomit that looks like coffee grounds, weak or heavy legs. This is potassium chloride, and then this also, there was a study done that I found when I was looking through all this, and I'm just like, I know that we're not injecting this into someone's heart, but we also need to be aware that potassium chloride has been used to stop the heart, and it has been used in studies to induce fetal demise, and I do have the link to this as well, and it's a retrospective cohort study of the I never can say this word either, efficacy, and safety. And basically it said the results were the gestational age at termination was 22 weeks. 192 of the 191 procedures were successful, and they were able to terminate unwanted pregnancies using potassium chloride by injecting it into the fetus. And after some seizures, the patient then died. So that's a little scary that potassium chloride is used in an injection form to stop the heart in abortions. So if that's the case, then I'm not sure about injecting that into my body. So there's that one. Alright, then the next one is calcium chloride. Calcium chloride is in intravenous solution. It goes on, oh me, they're all pretty much the same. I mean, a lot of these reactions are pretty much the same. Signs of an allergic reaction: rash, hives, itching, red, swollen, blistered, or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing, swallowing, or talking, and trouble breathing, swallowing, or talking. There's that one again. Unusual hoarseness. Oh, there's that one. My husband's been hoarse for like 2 months. I had not seen that one before. So, interesting. Swelling of the mouth, face, lips, tongue, or throat, dizziness or passing out, mood changes, change in how much urine is passed, a heartbeat that does not feel normal, back pain, belly pain, blood and urine, may be signs of kidney stones. The drug may cause tissue damage if the drug leaks from the vein. Tell your nurse if you have any redness, burning, pain, swelling, blisters, skin sores, or leaking fluid where the drug is going into your body. Okay. Other side effects: bad taste in your mouth, hot flashes, not hungry, upset stomach, throwing up, constipation, feeling tired or weak, more thirst, or bone pain. Okay, and of course this goes on and on and on. And this is from drug.com, so this is just, I looked up the drug and then looked at the side effects. So just more common side effects are frequency of breathing, lack of irregular menstruation, lower backside or stomach pain, mood or mental changes, muscle pain or twitching, nausea or vomiting, nervousness or restlessness, swelling of feet or lower legs, unpleasant taste, unusual tiredness or weakness. Less common: chills, fever, joint pain, sore throat, unusual bleeding or bruising. And then we have the rare. I'm not even going to go into the rare. I'm just doing the normal ones, and I'm just telling you people, wow. Wow. We're not done yet. We're not done yet. These are some serious side effects. I've only gone over like the first 3 or 4 ingredients. We've got a good many left to go. And this was one of the flu vaccines that I found that had the fewest ingredients in it. So this is one of the safest ones that I could find. I did not try to go with the scariest one. The scariest one had something in it that was just really scary. It's one of the newest ones, and it had Severitum in it, I believe it was. I'm not sure the name of the of that item that's in there, but scary. So I went with one of the ones that did not have as many vaccine ingredients in it. So I'm not trying to scare you. I'm not trying to do an emotional for you. I'm just trying to lay out the facts for you so that you understand what is in this and every single ingredient in this that's causing these reactions that my husband did experience. And I've done this word over and over again, still don't know how to pronounce it. Ovalbumin. It's an egg protein. And these are, the vaccines are prepared in eggs. They're not organic eggs, so they're going to have GMOs. Whether or not you feel anything about GMOs, that's up to you. I personally try to go as organic as possible. They may contain growth hormones, antibiotics, and salmonella bacteria, because they cannot really test the eggs for the salmonella very well, or they don't. It doesn't say whether or not they try to make sure that the eggs are safe. I could not find anything on that, on if they're like really making sure these are good eggs. I would really love if they were organic eggs at least. And if that's the case, also at the very end I'm going to be discussing what can be in your vaccine that's not on the ingredient list due to the egg protein in your vaccine. But I'm going to do that at the very end, so we'll be getting back to that later. Sucrose. I couldn't find anything on sucrose. The only thing I can think about why sucrose might be in there, because I mean, why would you put sugar? That's basically sugar. Why would you put sugar in your ingredients? When my son was circumcised, they gave him a sucrose pacifier that was supposed to help him with the pain. I don't know if that's supposed to maybe help the pain at the injection site. I'm just guessing on that one. I have no idea anything about the sucrose. I couldn't find anything bad about it. Couldn't find anything good about it. I just think it's weird to stick sugar in your veins. That's all I have to say about that one. I don't know. Okay, so neomycin. If you don't know what neomycin is, it's an antibiotic. Obvious reasons why they would put that in there, to keep you from getting any kind of infection from the vaccine, and probably to keep the vaccine from having issues. But neomycin has some issues. So loss of hearing, clumsiness, diarrhea, difficulty in breathing, dizziness, drowsiness, greatly decreased frequency of urination or amount of urine, increased amount of gas, increased thirst, light-colored, frothy, fatty appearing stools, ringing or buzzing or feeling of fullness in the ears, skin rash, unsteadiness, or weakness. Some side effects of neomycin might occur that usually do not need medical attention. Some will go away. Also, your healthcare professional may be able to tell you about ways to prevent, reduce some of these side effects. More common, irritation or soreness of the mouth or rectal area, nausea or vomiting. So that is neomycin, and it also has a whole lot of other metabolic issues, nervous system issues, can cause neuromuscular blockage, neurotoxicity, nystagmus, paresthesia, vestibular toxicity. I mean, I can't even say most of these things, but it sounds pretty scary. There's a whole lot of things. Confusion, dermatitis, nephrotoxicity. It can also cause a superinfection, respiratory paralysis. There's that again. I keep running into every single one of these saying that about some kind of breathing issues. And here is one of those like wow moments for me. I was really surprised about this one because I'm seeing pregnant women are told, get your vaccine, get your vaccine, get your vaccine, get your vaccine. And so this one really upset me just a little bit, because at the very top of the page on the ingredient polymyxin B, I saw this warning. This medicine has not been fully studied in pregnant women. Warning. So I'm like, we don't even know if this is safe for pregnant women, and we're giving it to them. And that just makes me a little upset. The medicine may cause kidney problems. Have your blood work checked if you were told by your doctor, or you're unable to pass urine. Medicine may cause nerve problems. Signs of these nerve problems may be irritation, weakness, feeling sleepy, change in balance, numbness or tingling around the mouth or the arms or the legs, blurred eyesight, trouble breathing. Most of the time, these nerve problems happen in people with kidney problems. Tell your doctor if you have a kidney problem or if you have any of these signs. Are you told when you get your flu vaccine whether or not you're supposed to let them know about kidney problems? I don't know. Do they ask that question? Do you have any kidney problems? I don't know. I don't ever get flu vaccines. I don't know this information, but I really hope they ask that question because that's scary. Do not use polymyxin B if you're taking any drugs that can cause kidney or nerve problems like amikacin, bactrasin, cephalidrine, colistin, gentamicin, kanamycin, neomycin. Wait a minute. What? And paromycin, and there are many other drugs that can do this. So, whoa! I just saw something new here, y'all. Whoa. So, polymyxin B is not supposed to be mixed with niomycin, and both of these things are in this vaccine together. They can cause kidney issues if they are put together. Whoa! Do you see what I'm saying here? This is scary. I don't know how you could not think this is scary. Please think this is scary. So they're putting niomycin and polymyxin B together, and on the warning label on the page for this ingredient, polymyxin B, it says do not mix with niomycin. These both are in your vaccine if you're getting the flu vaccine. Alright, it's used to treat bacterial infections. That's what polymyxin B is for. So there's that. Incidents not known. It can cause dizziness, drowsiness, fever, headache, numbness, pain in lower back or side, shakiness, unsteady walk, stiff neck, unsteadiness, trembling, or other problems with muscle control or coordination. Just, it goes on. I'm going to stop there. Alright, so, I just, can't get over it. My thing was so long that it has now restarted, and I'm having to go find where I was. It's going to take just a second, y'all. Let me get back to where I was, because this is very long, and I'm so sorry this is long. But, you know, I just really think that we need to be informed before we do things, and people need to research things. And, you know, sometimes you just don't have time to look at this kind of stuff. You don't have time to look up these things. You don't have time to try to find out if things are safe or if they're okay. But you need to make sure and, you know, look up things. Alright, also on polymyxin B. The other thing about it that I saw that was really disturbing to me, this is the one that I saw that I was just like, you've got to be kidding. So I saw this when I looked it up, and it actually says that they stopped using it. Oh, my little pictures didn't show up. It was this like chemical safety warning on here. And the chemical safety warning had like 3 or 4 like dangerous, chemical, do not touch, do not breathe in, and it had known carcinogen. All these 3 big warnings across the top, and this is for that polymyxin B. Okay, so we already know that it's mixed with the niomycin, and that those two together are really bad. But then when you just look at the polymyxin B just by itself, this was the ingredient that I just went, whoa! No way! I can't get over it. I'm just in shock at this. It's a disinfectant used in vapor form to sterilize vaccines, grafts, etc. It is very irritating, and the liquid form is carcinogenic. Okay, so we are putting a known carcinogenic in a vaccine and injecting it into everyone every year. Okay. Just there you go. Alright, so we've looked at all these ingredients. I have 2 more things to tell you. The first one is we did not go into the thimerosal because that's not in all vaccines, but it is in the multi-dose vaccine. So I am going to look at the formaldehyde and the thimerosal, because the formaldehyde is in some of the vaccines and the thimerosal is in some of the vaccines, and you don't necessarily know which one you're getting. So Formaldehyde is a pickling chemical used to preserve cadavers. It is highly toxic to the nervous system, causing blindness, brain damage, and seizures. The U.S. Department of Health and Human Services openly admits that formaldehyde causes cancer. You can see this for yourself on the National Toxicology Program website featuring its 12th report on carcinogens. So I have that link as well if you want to look at that. There's a formaldehyde fact sheet that completely neglects the mention of formaldehyde in the vaccine. This is, it does state that formaldehyde causes myeloid leukemia and rare cancers, including sinonasal and nasopharyngeal cancer. And I'm sure I'm saying that wrong because that's a really long word. So there's that. So if you're going to get the flu vaccine, try to make sure at least it doesn't have formaldehyde in it. I mean, you're going to get your whatever that was. Let me go back and look at it again. It's such a long word, y'all. I'm trying my best here. Polymyxin B, you know, and you're going to get your niamycin, so, you know, woohoo. Alright, so formaldehyde, there's that. Now, thimerosal, if you're getting a multi-dose vial of the flu vaccine, which I'm guessing you can ask your doctor if it's multi-vial or not, I don't know. Methylmercury compound that causes severe permanent nervous system damage. Mercury is highly toxic to the brain. You should never touch, swallow, or inject mercury at any dose. There is no safe dose of mercury. Doctors and vaccine pushers tell you that there is no mercury in vaccine, but the CDC readily admits vaccines still contain mercury in the form of thimerosal. They basically stopped putting mercury on the label and they started labeling it as thimerosal, so if you don't know what you're looking at, then you don't realize you're getting mercury. In addition, the National Toxicology Program admits in its own documents that vaccines may produce small but measurable increases in blood levels of mercury. Thimerosal was found to cross the blood-brain placenta barrier, and we're giving this to women when they're pregnant. The hazards of thimerosal include neurotoxicity and nephrotoxicity. This means brain and kidney toxicity. Similar toxicological reports or profiles between ethylmercury and methylmercury raise the possibility that neurotoxicity may also occur at low doses of thimerosal. There are no existing guidelines for safe exposure to ethylmercury, the metabolite of thimerosal. The assessment determined that the use of thimerosal as a preservative in vaccines might result in the intake of mercury during the first 6 months of life that exceeded recommended guidelines from the Environmental Protection Agency. In the U.S., thimerosal is still present as a preservative in some vaccines given to young children as well as certain biological products recommended during pregnancy. Thimerosal remains a preservative in some vaccines administered to adolescents and adults. In addition, thimerosal continues to be used internationally as a vaccine preservative. The report then goes on to say that the FDA studies thimerosal and somehow found it to be perfectly safe. It also states that the vaccine manufacturers are working to remove thimerosal from vaccines, but in reality it's still being manufactured right into the vaccines. By the way, this report also reveals that the FDA requires preservatives like thimerosal only in so-called multi-dose vaccine vials that contain more than one dose of the vaccine. They could produce clean single-dose vaccines without mercury or thimerosal, but they choose not to because it's more profitable to do the mercury-containing multi-dose vaccines. Preservatives are not required for products formulated in single-dose vials, multi-dose vials, Okay. So I've got the link for that as well. That's the University Health News. So they've got all the links. I make sure to check to make sure they have the sources and they have all the links back to the FDA websites, SDC websites, vaccine injury websites. All of that's there. All those links are there if you want to double check me on that. Not just making this up as I go. So that's your formaldehyde and your thimerosal. Alright, so now I wanted to discuss with you that in your vaccines, the egg protein that is in there, and this is for all vaccines, they're all going to have either some kind of egg protein or bovine serum. This is going to come from a cow. They're going to have something from some animal, and then of course the animals are eating. What are the animals eating? If you're not getting bovine serum from a grass-fed cow, then you're going to be getting GMO products that are being fed into the cow, and then those GMO products are then going to go into you. And what is the problem with GMO products? Well, one of the problems that we're having right now is pesticides, and the pesticide glyphosate, which I probably said it wrong, but glyphosate is a known carcinogen, and they are now finding this in vaccines. The study was really interesting. I actually watched the video. I have the link to that too, the link of the man that did the study on this. He looked at vaccines, all the different makers, not just one in particular, but he was interested to find out if this is across the board. And across the boards in vaccines, he found that glyphosate was in these vaccines. Not that they put it there purposely, but because if you have a chicken that eats GMO corn with pesticides on it, and then you have that chicken lay an egg, and you use that egg in your vaccine, that egg is then going to be contaminated with those glyphosates. And also, if you have a cow that is eating those pesticide-laden foods, and then that cow is used for that serum, you're also then going to be getting the same issues. So that glyphosate is not put in there on purpose, I guess, but it is there, and they have found it across the board in all of the companies, because they're not using grass-fed, they're not using organic, they're using pesticide-laden GMO products to feed these animals that are then getting killed and then getting used to put into our vaccines. So you are looking at some contamination there, and you can look right now. It is a known carcinogen. There are studies being done on this. It is huge right now. There is even a court case right now. It may have already been finished. I don't know, of the couple that got cancer from glyphosate, and they're suing Monsanto. So it's a huge deal right now that this is in the vaccines as well. And I've got the link for that as well. And the pesticides containing these disease-causing chemicals like glyphosate, many parents wouldn't dream of letting their kids eat anything but organic, but now these are causing harm because you're injecting this. So it's Stephanie Seneff and Anthony Samsel did the study that showed this dangerous chemical was in the vaccine. So the World Health Organization has actually said probably carcinogenic to humans. Once it has been injected, it could set in motion a cascade of diseases far worse than those targeted by the vaccines in the first place. So here you are, you're getting your flu vaccine. You're being a good citizen. You were told to go and get your flu vaccine. You are doing what you were told to do. You are going and you're getting this every year, and you are having health problems. And I'm not saying all of your health problems are from your flu vaccine. I am saying look around you at your environment. Look at all the toxins that you are getting in your environment anyway. And then add in any additional toxins and try to stay away from as many toxins as possible. So try to eat organic. Try to eat, and I know I've seen people say that there's nothing wrong with GMOs, there's nothing wrong with pesticides. There is proof out there that would state otherwise. And I'm not going to debate you on that. That's fine. If you want to eat GMO and you think it's fine, that's great. But there's research showing that this is harmful. So you try to eat a healthy life, try to eat a clean life, try to live a clean life. And that, for me, involves no longer receiving a flu vaccine. For my husband, it involves no longer receiving a flu vaccine. He is now trying to find a different job. That's just where it is, because he cannot. He's told me he has to leave his job before November. That's our cutoff. He has to leave there before November because he cannot get this flu shot because he is sick. I don't know, you can probably hear him coughing in the background. He's coughing in the background right now. He's in a different room. I can hear him. He's sick. He's been sick this whole time. And there, we cannot figure out anything else that it could be. It's got to be it. And I look at every single ingredient in this vaccine, and every single ingredient that says causes asthma, causes difficulty breathing, causes tonsillitis, causes sore throat, causes this. It is an issue. We need to make sure that we are careful with our bodies and that we do the best thing with our bodies. And this, to me, is another issue that needs to be discussed. Yes, it's awful to have the flu. It is awful to have the flu. But In most cases, you're going to live through that and you're going to be okay. You may not live through it. And I am sorry for those of you that have had people in your life that have died from the flu. I am not saying that it is not an important thing. The flu can be bad. The flu can kill you. I do realize that. But I also realize that it may not be as bad as the vaccine is. The vaccine appears to have a lot more side effects and a lot of problems that can be worse to me than the flu. So I'm just putting that information out there for you. I will be putting all of the information down for y'all to see where to go and find the information for yourself. You can look it up because I'm a serious researcher. I want to know the facts and I want to know where they came from. So I'm going to put all those facts out there for you so you can look at them. I'm also going to be uploading this to YouTube and I'll be putting all those facts there. So you're welcome to follow me on my YouTube channel and share this. Let people know. Get the information out there because we have a lot of people that do not have information on this, do not understand, and they're wanting to mandate vaccines. If these vaccines are mandated, people like my husband could die. He's still sick 6 months later. So in 6 more months, when he gets another one, it's going to then get worse and worse and worse. If this is mandated and he absolutely has to have this in order to live in this country, he could die. I don't know that people understand this situation. This is serious. Also, if this is mandated, there are people that are allergic, like myself, to eggs and dairy. My son is even allergic to beef, and the bovine serum in there is beef. So my son is allergic to the eggs, the milk, and the beef. All those things that are in a lot of these vaccines, all 3 of those are ingredients are in the MMR vaccine. So this is huge for people that are wanting this mandated. Please think about that. Think about how this affects the people that have allergies, that are very sensitive to toxins. Not all of you are going to have that kind of problem, but some people are going to be affected in this way, and we need to understand that. And if people want to keep on going out and getting their flu vaccine, more power to them, but please be informed before you do. So I'm going to leave y'all with that today. If you have any questions for me, please let me know. I'm more than happy to answer them. But let's be kind to each other. Let's not be ugly and name call. And if you have a question, I'm more than happy to answer it. But let's not be ugly about it. So I will see y'all later. I'm probably going to be doing a steroid video next. And that will happen in the next few weeks. So I'm excited about that. And we will find out more about the steroid shots and how those affect your body. So I will talk to you later. Bye.